Good morning, delegates, both here physically and online, and those who are going to be in a high flex situation. It's a pleasure to invite you here today to discuss a very important issue, as you have heard from one of the people in Strathmore, one of the professorial staff we have trying to challenge the new concepts of healthcare, Dr. Franco Fuller. I hope soon I'll be calling you Professor Franco Fuller, because you're long overdue. Long overdue for that position. Dr. Kibias Simon, I don't know you personally. Is this one here? Umeweka hii gia, wacha nikuone vizuri. Hello, Bwana Kibias. Asante sana. Thank you very much for being there. He's the head of the Directorate of Health Standards, Quality and Regulation, Ministry of Health, and he is representing one of our former staff members in Strathmore University, Dr. Rashid Aman, who was working in the consortium we have with KEMRI. We call the Center for Research in Therapeutic Sciences. I don't know whether you know that the Center for Research in Therapeutic Sciences was started back in 2011, 2012. And they have been foremost in the biomathematical research in nanotechnology to transform especially clinical trials in malaria. But most of all, Dr. Rashid Ahman, Dr. Benhadzo Butu, Dr. Florence Olo, and all the team at the clinic there were part and parcel, and a significant part and parcel of the clinical trials for the malaria vaccine. Right? And I wanted to give them a big clap. One of the researchers in nanotechnology here in the Center of Therapeutic Research, which we call CREATE, patented a product. That product came from trials of how do we have more efficacious drugs for pediatric or postpartum treatment of malaria in children between 3 months and 5 years, or between 1 year and 5 years for the medical doctors. They can understand that. And through nanotechnology trials and effective research, we actually increased the capability of the malaria drug produced by Wellcome from around 60% to 90%. I say 60% because we want to be generous, but it is between 45 and 60%. And they actually made it through nanotechnology, molecular technology, to bring it to a level of 90% effective for children between 1 year and 5 years. We did not make noise about that because it was patented under Wellcome. I don't know whether they changed the drug. What Frank has said is fundamental. And in welcoming you here to speak about public-private partnerships in health, it's not something we thought of recently. Innovating healthcare in this country requires the partnership of those who govern public and their citizens, private. Those who govern run the ministries. Those who govern manage policy. And those who are governed apply those policies for better healthcare in this particular case. Convener Dr. Franco Fuller, my deputy, Angela Dunge, another convener, Dr. Mary Korir. Where is she? Is she sitting here? Mary Korir. our sponsors, Fences, KEPSA, Kenya Health Federation within KEPSA, our own Strathmore University Business School, guest panelists who are going to discuss the issue of improving healthcare innovation in the country and in Eastern Africa and in the Comesa region and in Africa in general, and your participation in the world, as we saw in the case of the innovation of malaria treatment and especially vaccine. By the way, I didn't want to say other things, but as you know, quite a period of time between 2015 and 2019, we had one of the most advanced specialized treatments on leukemia. When you hear Strathmore, you don't hear those things, but we probably had one of the most advanced treatments of leukemia. Anyway, two things. People are dying. Our rate of death per birth is in the region of 21 per 1,000. What do you call them? Per each human giving birth. We have come down from 46. So that's a reasonable number. The rest of Africa is quite far. I think we may reduce it to 12, but the most advanced countries have reduced it to 3 women, especially in Europe. Which methods must we use? How will we connect policy between Medicare at the service level, at the policy level, and at the health center level? How will we get nurses to participate and get trained? You know, one of the problems of giving birth in this country is that 3/4 of the machinery and the instruments and the tools and the capability of our nurses in the health centers up to level 5, you know what it is? That many times, and I'm sad to say, they're using the machines in a way that is killing babies. And now I am not exaggerating. I was having a deep discussion with the chair of the Department of Pediatrics in the University of Nairobi, who is now working with us here. And she told me about the disaster of lack of skills capability. Why? Second, governance. We are sick and tired of people transmitting or providing medicine to our populations and our citizens that have been doctored. Expiry dates have changed. The most intelligent brains in the country, our own medical doctors, cannot see why it is necessary to put drugs in a fail-safe condition. Our drugs in the public sector and for our publics are in tents, started tents. Ladies and gentlemen, we have ARVs for those sick with HIV. It's abhorring to think of the state of storage of our medicine, the stage of treatment of all those people who are totally dependent on those ARVs. Not to mention the misuse of public resources, donor resources. We are sick, but the sickness is not that we are unhealthy, it's that because we don't want to be healthy. Now, our nation takes care of its mothers because the first and primary resource is the people, and takes care of the father for the defense of that child. It is the second highest after governance and education, or third highest, common good of humankind. So what are we going to do about it, ladies and gentlemen? You may come to me with stones, and I've been throwing stones this morning, and I apologize. But something in my stomach turns when I think of the more than $150 billion of donor funds put in treatment last year that have been misused. But that's not our job today. Our job is to provide solutions, and we have built a beautiful community of healthcare scientists, healthcare managers, healthcare communities of practice. We even have one of our research projects leading the top scientists in the world. Dr. Pratap is leading a science of e-technology in treatment of mothers in rural areas. And they already have the gadgets where mothers can actually be managed from their home position. And they are doing it. And we have this community here. And now we are looking forward to setting up one of the best biomedical research centers in Africa and probably in the world, using mathematicians, healthcare workers, managers, accountants, financiers, health economists, policy makers in health. How do we build a beautiful country with the best healthcare services, learning from the best in the world? Ladies and gentlemen, I leave you with those little things. I apologize for probably mentioning something that our guest of honor today may want to mention. I apologize of using some statistics because we are not too accurate in our statistical analysis of issues in Kenya. And you know why? Because our statistics are in significant number of pockets that never talk to each other. All right, our data is in approximately 27 different siloed centers. So we cannot make any decision relevant. Now, you can think Kenya is good and we are doing very well, all right, and building level 5 hospitals instead of getting healthcare preventive activity on the ground. We are busy building level 3, 4, and 5 hospitals so that we can have a lot of money in our pockets through the construction and development funds. Whereas we should be putting a lot in prevention, especially of non-communicable diseases, of which we are only putting less than 40% of our funds. I say 40% because from the budget it is 40%, but from reality, half of it is stolen. And drugs are left in countries that I don't want to mention for political reasons. Sorry, Wana Kibias, I have to say the truth, but with a deep understanding that we have the brightest minds to solve these issues. And with those few remarks, may I, Frank, if you wish, with your guidance and with the MC's guidance, thank you, Madam MC, guide me on whether I should invite Dr. Kibias now. Okay, on behalf of Strathmore University and Strathmore University Business School's Institute of Healthcare Management and all the team of University Business School, I see my Associate Dean, Helen Otieno here. I see the Director of Postgraduate Studies, Madam Stella Nyongesa there. Thank you. I see our Director of Marketing here quietly watching with eyes because she's covered her mouth. Dr. Kibias, Head of Directorate of the Health Standards, Quality and Regulation at MOH. Karibu sana Strathmore. Kindly greet all those people and friends of mine online. We are happy you are there and feel free to participate with a lot of joy. If there are any dignitaries online, feel respected and honored today. And over to you, Dr. Kibias. Karibu sana Strathmore. Let's give him a big clap.